The procedure begins with diagnostic laparoscopy. A laparoscope is introduced through the umbilical port to inspect the abdominal cavity. Both internal inguinal rings are carefully examined, allowing precise identification of the intra-abdominal testes and assessment of their location before surgical mobilization.
Following the initial diagnostic survey, attention is directed toward identifying both intra-abdominal testes. The laparoscope provides a magnified view of the internal inguinal rings, allowing careful assessment of the exact position of each testis. The surgeon evaluates the relationship of the testes to the surrounding structures, including the vas deferens and testicular vessels. Their mobility, size, and distance from the internal inguinal rings are carefully examined. This detailed anatomical assessment is essential for planning safe mobilization and ensuring that adequate length can be achieved for successful orchiopexy without placing tension on the spermatic cord.
Once both intra-abdominal testes have been identified, careful mobilization begins. Using precise laparoscopic dissection, the peritoneal attachments surrounding each testis are gently released. The dissection proceeds in a controlled manner to maximize the available length of the spermatic cord while minimizing tissue trauma. Every movement is deliberate, ensuring excellent visualization and maintaining respect for the natural anatomical planes throughout the procedure.
As the dissection continues, the surgeon progressively frees the spermatic cord from surrounding peritoneal tissues. Gentle traction and meticulous countertraction are applied to improve exposure while preserving tissue integrity. The objective is to obtain sufficient cord length, allowing the testes to reach the scrotum comfortably without excessive tension. Continuous laparoscopic visualization helps maintain precision during every step.
Particular attention is given to identifying and preserving the vas deferens throughout the dissection. The vas deferens is carefully separated from adjacent tissues without stretching, twisting, or compromising its blood supply. Gentle handling of this structure is essential for maintaining its integrity and supporting future reproductive function. Careful laparoscopic mobilization of the intra-abdominal testis is now performed. Gentle traction provides optimal exposure while the surrounding peritoneal attachments are meticulously divided. Throughout the dissection, the vas deferens and testicular vessels are clearly identified and preserved to maintain their integrity. Dissection follows the natural anatomical planes, minimizing tissue trauma and maximizing spermatic cord length. Constant visualization ensures safe release of the testis while protecting adjacent structures. Adequate mobilization at this stage is essential to achieve a tension-free orchiopexy and preserve optimal vascular supply to the testis. Attention is now directed to the right side, where meticulous dissection is performed to preserve the vas deferens, testicular vessels, and the adjacent ureter. Under continuous laparoscopic magnification, each structure is clearly identified before further tissue release. The surrounding peritoneal attachments are carefully divided while maintaining the integrity of the spermatic cord. Gentle traction and precise dissection help maximize cord length without compromising the vascular supply. Throughout this stage, the ureter remains under direct visualization, ensuring safe mobilization while protecting all critical anatomical structures. The same meticulous technique is then applied to the left side. The vas deferens and testicular vessels are carefully separated from the surrounding tissues using precise laparoscopic dissection. Every movement is deliberate to preserve the arterial inflow, venous drainage, and the continuity of the vas deferens. The ipsilateral ureter is continuously identified and protected throughout the procedure, preventing inadvertent injury. Once complete mobilization has been achieved, the testis demonstrates excellent mobility with an intact vascular pedicle, providing the optimal conditions for a tension-free orchiopexy. Following complete laparoscopic mobilization, The first testis is gently guided toward the scrotum without placing tension on the spermatic cord. Throughout this stage, continuous laparoscopic visualization confirms that the vas deferens and testicular vessels remain well perfused and free from twisting or compression. The laparoscope provides magnified visualization, while laparoscopic atraumatic graspers are used for gentle tissue handling. Once the testis reaches its intended position, its orientation is carefully assessed to ensure a natural anatomical lie. Stable positioning is confirmed while preserving the integrity of the vascular pedicle. This final assessment ensures that the testis is appropriately positioned with excellent mobility and uncompromised blood supply before proceeding to the contralateral side. Attention is then directed to the opposite side using the same meticulous laparoscopic technique. The second testis is advanced into the scrotum under direct visualization while maintaining the natural alignment of the spermatic cord. Throughout the procedure, laparoscopic atraumatic graspers and the high-definition laparoscope provide precise control and continuous visualization of the operative field. The vas deferens and testicular vessels are re-evaluated to confirm that they remain intact, untwisted, and well perfused. Final inspection demonstrates symmetrical positioning of both testes with a tension-free vascular pedicle, completing the bilateral orchiopexy with anatomically satisfactory placement and preservation of normal vascular integrity.